Did you take your child to the emergency department because you thought they had croup, but they really didn't? So here are 5 diseases that look like croup but aren't, but are just as medically dangerous as croup. So save this video because you may need to refer to it later. So I'm Dr. Hassan-Ali, double board certified pediatrician, and let's talk about these croup dupes. So number 1 is epiglottitis. This is a medical emergency. So these children present with significantly high fever, they have difficulty breathing, they have sore throat as well, and you also see that they hyperextend their neck so they can breathe better. If they start having stridor or noises when they breathe in, that can be a very late sign and a concerning sign. This is an immediate 911 call. Number 2 is what's called bacterial tracheitis. So again, these children present with high fever. They actually look very sick as well, and they don't respond to your typical croup medications that I talked about in the last video, like dexamethasone and epinephrine. Most commonly, it's caused by diphtheria, but luckily, if your child is vaccinated, both in Canada and the United States, then diphtheria is part of the routine vaccination schedule. Number 3, another dupe is actually foreign body aspiration. So things like peanuts, fish bones, or Lego pieces. You can also have choking, stridor, and difficulty breathing. But typically there is an ingestion that has happened just before the symptoms occur, and typically no viral symptoms. Number 4 is either a peritonsillar abscess or a retropharyngeal abscess. So in these children, they'll have a bacterial infection, they'll have significantly high fever, difficulty breathing, coughing as well, and you'll also see what's called torticollis, which is when their neck sort of tilts like this, depending on where the infection is. You'll also notice that they drool, which is not really common for croup. And number 5, the last dupe you need to be aware of is an allergic reaction. So let's say you've been exposed to an allergen, such as peanuts or shellfish, or any other type of allergen that can cause narrowing and obstruction of the airway, which also causes things like coughing, stridor, as well as wheezing. But you'll typically also have other symptoms like vomiting or a rash or hives on your body, or sometimes even a drop in your blood pressure. And there's typically some sort of agent that causes this allergic reaction either 15 minutes to about a few hours before your symptoms arise. In any of these cases, these are medical emergencies and you do need to call 911 or head to your nearest emergency department for a medical assessment. In all of these cases, your airway is closing, and so we need to get access to your airway, whether through medication or through technology, to save your child's life. As always, follow Peds Patrol for more tips. And if you have any questions or concerns, comment below and let me know.